The topic of discussion today is how to discover your inner strength and build resilience against depression and anxiety. To all of you, good morning and good evening. Greetings from this channel. I would like to use this occasion to talk to you and your loved ones about one strategy that I found to be very effective when I was first diagnosed with high blood pressure, anxiety, and panic attacks. This is a personal story which I hope will be of great assistance to all of those currently suffering from anxiety in all of its forms. The secret I'm going to present to you will help you not just in overcoming depression, but it's also applicable and might be just as significant when dealing with other stresses in life. Therefore, all I'm asking of you in this regard is to like and subscribe so that this content can reach many other people fighting a similar condition. So let's get right to my experience struggling with depression. I remember about 2 years ago when I was always complaining about severe migraine. This condition progressed for 2 full years, and I can assure you that there was no single day within the 2 years which I failed to complain of severe headache. Sometimes, the pain could be so severe to the extent that I could experience blurred vision and even feel total general body weakness. I tend to presume that most of you, just like I did, prefers to sleep if not engage in heavy alcohol consumption when faced with very difficult situations. Give me your comments on the comment section below about the same, but I am glad to say that my number one remedy then for managing my migraine was just shutting my system down in deep sleep. I was totally oblivious of my condition the entire 2 years. Remember, I had a family looking up to me despite being totally jobless. Just imagine being jobless and having daily needs to fulfill. What comes into your mind is to push yourself way beyond your limits, right? But I can affirm to you that this was and definitely will be your number one way of being a very loyal and good friend to some of the most serious and chronic lifetime diseases such as diabetes, kidney failure, and hypertension. There is nothing cruel to a job seeker like making so many attempts without a single success despite having the right qualification. And just like the many others in the same state, I found myself deeply seated in depression, anxiety, and resentfulness. My level of anxiety and depression increased day after day until it presented me with an additional new friend called frequent panic attacks. The panic attacks were so frequent to the extent that I stayed awake throughout several nights. As I had indicated earlier that sleep could at least lessen the impacts of anxiety in me, just imagine the resultant impact in me having been deprived of the same. Let me bring to your attention that life became unbearable, and it was at this particular point in time that I decided to visit a clinic. To my dismay, the doctors inquired whether or not I was in any form of steroid medication since my blood pressure was way above the normal range. As you can tell, the doctor's immediate recommendation was to prescribe for me some pills for managing the high blood pressure, which of course I was hesitant to begin using given the fact that I was only in my late 20s and was not psychologically prepared to handle a lifetime medication. Even though my condition worsened thereafter, I decided not to take any pills but instead resorted to finding my inner peace since it was the main course of my condition given the fact that I don't engage in any form of hard drugs abuse. In this regard, therefore, I decided to gradually stop worrying about things which were beyond my control like urgency and pressure to find a job even though I was still actively engaged in the quest of the same. Additionally, I engaged myself in routine outdoor activities like jogging, meditation, trying to sleep as much as possible, being around other people, and watching funny YouTube or Facebook reel videos which actually brought me great joy. These were some of the practices which I adopted and greatly calmed the anxious storm in me and paved a new path of positivity, fulfillment, and most importantly, brought me great inner peace which saw the rapid drop in my blood pressure. It has been now 2 years since I was first diagnosed with high blood pressure, but I can confirm to you that I have never ever taken any form of pill medication. I am happy to report that my blood pressure is very normal. I no longer suffer from any form of anxiety or depression, and I am blessed with peaceful sleep like a baby. I can confirm to you that I manage my condition by applying the said practices. However, there are other practices which I would like to suggest to you as follows. 1. Therapy. This can help you as a person to explore your emotions, thoughts, and behaviors and develop coping strategies. 2. Lifestyle changes. Engaging in regular exercise, maintaining a balanced diet, getting adequate sleep, and avoiding alcohol and drug abuse can support your overall mental well-being. 3. Social support. Building and maintaining strong social connections with friends, family, or support groups can provide emotional support and a sense of belonging you need. 4. Mind-body techniques. Practices such as yoga, meditation, deep breathing exercises, or progressive muscle relaxation can help you to reduce stress and promote relaxation. 5. Routine and structure. Establishing a daily routine and setting achievable goals can give you a sense of purpose and accomplishment, which can be beneficial for managing depression. 6. Professional help. Seeking help from mental health professionals, such as therapists, counselors, or psychiatrists, is crucial for accurate diagnosis, treatment planning, and ongoing support. 7. Medication, which actually is my last option, involve antidepressant medications which may be prescribed by a psychiatrist. In conclusion, it's essential to remember that effective management of depression often involves a combination of these approaches tailored to individual needs, seeking help early, and being patient with the treatment process. If you like the content of this video,